So, picture this. You are standing right in the middle of your kitchen.
Oh boy, I think I know where this is going.
Right. You've got like a little smudge of peanut butter on your index finger, and there's this tiny pill resting in your palm, and suddenly you completely freeze. Total paralysis.
The classic kitchen freeze.
Exactly. You're staring down at your dog, and, they're just happily staring back at you, waiting for their treat. And you think to yourself, wait, did I give this to you already this morning, or am I remembering yesterday?
It is like the universal pet owner experience, that sudden sinking realization that you have absolutely no idea what just happened in your own daily routine.
It's terrifying.
It really is. It's like your brain has entirely deleted the last 10 minutes of your life.
Okay, let's unpack this because it's an incredibly stressful moment for anyone.
Yeah.
I mean, if you give the pill to them again, are you like double dosing them and crashing their liver?
Yeah, which is a real fear.
But then, if you throw the pill back in the bottle, are they missing a crucial medication and just totally opening the door to an infection? It is a terrible high-stakes coin toss.
It really is a gamble you don't want to take.
Exactly. So welcome to this deep dive. Today, we are extracting insights from an audio transcript from the Dog Health Academy. And our mission here is to figure out exactly why missing a dog's medication is a much bigger biological deal than we tend to assume.
Right. Way bigger than people think.
And more importantly, we really want to extract some foolproof practical systems for keeping our pets healthy without relying on our incredibly flawed human memory.
Because, honestly, relying on human memory to manage medical treatments is just a fundamentally broken strategy.
Yeah.
The transcripts we're analyzing today, they establish this right out of the gate. They feature this case study of an owner named David.
Okay, David.
Yeah, and David is a busy guy. He works full-time, has kids, and he manages 2 dogs with completely different medical needs. So he's got Scout, who's a 7-year-old beagle on daily medication for a chronic condition.
Right, daily.
And then there's Peanut, a 3-year-old mixed breed, taking monthly preventatives for heartworm, fleas, and ticks.
And for a long time, David's strategy was exactly what most of us do. He just tried really, really hard to remember.
Which never works out, does it?
No. Because human memory, especially like context-dependent memory, is just not designed for that. When you perform the exact same mechanical action in the exact same environment every single day.
Right, like opening a specific cabinet.
Yeah, opening the cabinet, getting the peanut butter, calling the dog. Your brain stops recording those individual instances. It optimizes by just blurring them all together into one giant memory.
Yeah, it's a shortcut.
It's the exact same cognitive blind spot that makes you wonder if you locked your front door the absolute second you get to your car.
Oh man, I do that all the time. But what's fascinating here is how that cognitive blind spot manifests differently depending on the medication schedule. Well, for David, during a really chaotic work week, Scout's daily pill would simply get swallowed up by the routine and forgotten. It just became background noise.
Right, the blur.
Exactly. But Peanut's monthly dose presented a completely different challenge. Monthly medications are inherently harder to track because they lack that daily repetitive anchor.
They just don't happen often enough to become a habit.
Precisely. Without a daily environmental cue, David was constantly second-guessing himself. Like, did I give the preventive this month or was that last month?
So David hits a breaking point, right? And he implements a physical system. He sets phone reminders, he puts a physical log on the refrigerator, and he designates one specific family member to actually verify the dose.
Yeah, he takes the brain completely out of it.
He essentially externalizes the memory.
Yeah.
He offloads the mental burden from his own unreliable brain directly onto the environment.
And that removal of the mental load is like the only thing that actually guarantees the dog's safety. It's not about trying harder.
That's just such a relief, honestly.
Right. It's about engineering an environment where you don't have to try at all. But to really understand why these systems are so critical, we need to look at what happens biologically when that memory failure collides with an urgent medical scenario.
The high-stakes stuff.
Yeah, and the highest stakes example in our materials is a course of antibiotics.
Okay, let's get into the mechanics of that, because this is where the behavioral stuff meets the biological reality. When a veterinarian prescribes a 10-day course of antibiotics, that timeline is not like a rough estimate. 10 days means exactly 10 days.
Right. It is a very precise pharmacokinetic calculation designed to eradicate an infection completely.
But humans mess it up.
Oh, constantly. This is where human psychology actively works against canine biology.
Okay.
We observe our dogs. We see that they had, a terrible cough on Monday. We start the antibiotics, and by Friday,
They're acting totally normal.
yeah, they're bouncing off the walls, bringing us their favorite toy. And the immediate human instinct is to think, oh, great, the job is done.
Okay, here's where it gets really interesting, because I want to push back on this a bit.
Oh, for it.
Because, humans do this with their own prescriptions constantly. You get a sinus infection, you take the pills, your fever breaks, and you just dump the rest of the bottle in the back of your medicine cabinet to save for next time.
Which doctors tell you not to do, by the way.
Right, but we do it anyway.
Yeah.
So if my dog is clinically presenting as perfectly healthy and energized, why is it considered so catastrophic to stop the medication early?
Because that burst of energy and the disappearance of the symptoms, it's a biological illusion. It's a trap.
A trap?
Yeah. When you introduce an antibiotic into a dog's system, it begins by killing off the most vulnerable, susceptible bacteria first. It's just picking off the weakest links in the infection chain.
Okay.
And that massive reduction in the sheer volume of bacteria is what causes the symptoms to fade so quickly. But the infection itself is not gone.
So if we look at, day 5, what exactly is left in the bloodstream?
The absolute toughest, most resilient bacteria, the ones that require the full 10-day duration to fully break down their cell walls or, disrupt their replication.
Oh, wow.
Yeah, so if you stop the medication at day 5 simply because the dog looks happy, you leave behind this elite, highly resistant population.
That sounds bad.
It's really bad. Not only does the infection bounce back, but by exposing those surviving bacteria to a sublethal dose of the antibiotic, you are actively driving bacterial mutation.
You're basically providing them with the exact training data they need to beat the drug next time.
Precisely. You are essentially breeding superbugs in your own pet.
Jeez. Yeah.
Yeah, so when that infection flares up a week later, that original antibiotic might be completely useless now. This is the underlying mechanic behind the absolute rule. You never use clinical observation, like how bouncy or happy your dog seems, to make clinical decisions about stopping a dog.
Okay, but what if they have a weird reaction?
If the dog has a bizarre reaction to a pill or throws it up, the protocol still isn't to quietly discontinue it on your own. You pick up the phone, call the clinic, and let the veterinarian adjust the strategy.
Now, I do want to clarify something here for the listener, just to alleviate some panic. If 10 days means 10 days, how rigid is the hourly schedule? Like, if I get stuck in traffic and give the evening pill 3 hours late, am I instantly triggering this apocalyptic superbug scenario? Or is there, a pharmacokinetic grace period?
Oh, that is a crucial distinction. Being a few hours late on a single dose rarely drops the drug concentration in the bloodstream below what we call the minimum inhibitory concentration.
Okay, which is what?
It's just the threshold needed to keep the bacteria suppressed. The catastrophic failure happens when you skip entire days or when you prematurely terminate the course. A minor fluctuation in timing is just a hiccup. Stopping at day 5 is the biological disaster.
Okay. Phew, that makes sense. So we can white-knuckle our way through a 10-day antibiotic sprint. We can maintain that level of intense vigilance for a week and a half, but the entire behavioral paradigm has to shift when we talk about chronic conditions. Like, what happens when the vet diagnoses your dog with a thyroid issue or epilepsy or severe joint deterioration and just hands you a bottle saying, every day for the rest of their life?
Yeah, that's entirely different. You cannot sustain sprint-level vigilance for a marathon. Attempting to do so just leads to burnout and eventually non-compliance.
Right.
To manage a chronic daily medication over years, you have to weave the new medical requirement seamlessly into the existing fabric of your life. The transcripts refer to this through the concept of anchoring,
which is essentially attaching the new fragile habit to an existing rock-solid habit.
Exactly.
Like, you're going to feed the dog every morning. The dog is certainly not going to let you forget breakfast.
Never.
So if the medication can be taken with food, picking up the dog bowl becomes the physical anchor that triggers the administration of the pill.
Exactly. You are utilizing an environmental trigger that already happens on autopilot. But chronic daily medications introduce a secondary, highly complex variable that antibiotics usually don't.
Oh. What's that?
A multi-human problem.
Yes. Oh my gosh, the household dynamic.
Yeah.
Let's say you successfully anchor the pill to the morning routine. You feed the dog, you give the pill, and you head out the door.
Sounds perfect.
Right. But 20 minutes later, your partner wakes up, sees the dog looking expectant, because let's be real, dogs are phenomenal liars when it comes to second breakfast.
They really are.
And your partner thinks, oh, time for the dog's pill. Suddenly you have a double-dose dog, or the inverse happens where both of you assume the other person handled it, resulting in 0 doses.
And we really have to look at why that double dosing scenario is so terrifying, depending on the drug.
It's not just extra sleepiness.
Well, if you double dose a basic antihistamine, yeah, your dog might just take a very long nap. But if you double dose a non-steroidal anti-inflammatory drug, an NSAI for joint pain,
Oh, those are common.
very common, but you are dealing with a drug that has a very narrow therapeutic index. Canine metabolisms process NSAIDs completely differently than we do. A double dose can severely restrict blood flow to the kidneys or cause severe gastrointestinal ulceration within hours.
Wow. Which means the multi-human problem isn't just a simple communication breakdown, it is an active safety hazard.
Exactly.
But the solution highlighted in the materials is beautifully low-tech. Step 1. Remove the ambiguity by designating one single person as the primary medication giver.
Yep.
And step 2, implement a physical paper trail. Literally just a sticky note on the fridge with drawn checkboxes.
It sounds almost too simple, but its brilliance really lies in its visibility. It requires zero technology, there's no apps to open, no passwords to remember.
Anyone walking through the kitchen can see instantly if Tuesday morning's box is checked.
Right, it creates an immediate shared reality for the entire household.
But let's be real about a long haul here. Doing anything perfectly for years is exhausting. Routines fracture, you get a new job, your kids change schools, your morning schedule just blows up.
Life happens.
Exactly. And I really appreciate how the Dog Health Academy material addresses this with genuine empathy.
They do. They recognize that sustained consistency is actually the hardest part of veterinary care. When an anchoring system stops working because your life changed, the default human reaction is just guilt. We feel like we are failing our pets.
Right, like we're bad owners.
Yeah, but the paradigm shift they suggest is to realize that you aren't failing. The system has just become obsolete. The goal is to drop the guilt, sit down, and intentionally redesign the anchor to fit your new reality.
Drop the guilt, fix the system.
I love that.
Now, daily meds have that daily anchor. But I want to move to what I consider the sneakiest challenge in pet care. Managing the monthly preventives.
Oh, yeah.
Heartworm, flea, tick, and deworming medications.
They are insidious precisely because they operate on an entirely different timeline. They completely lack a daily cue.
And there's no immediate reward.
Right. Furthermore, there is a significant psychological hurdle. Your dog looks perfectly healthy, they aren't coughing, they aren't limping. You give them a pill and absolutely nothing observable happens.
Right. Over months and years, that lack of visible urgency makes the preventive start to feel, well, option.
And I'm going to ask the question that I know people listening are quietly wondering right now.
Okay.
If my dog is generally healthy and mostly just hangs out in my own fenced-in, beautifully manicured backyard, is it really a massive crisis if I skip a month here or there?
Yeah.
Isn't mostly consistent good enough for preventatives?
If we connect this to the bigger picture, and specifically to the actual biological mechanisms of these parasites, mostly consistent is a disaster waiting to happen.
Really?
Let's look specifically at heartworm. Heartworm preventives do not protect your dog for the next 30 days. They work retroactively.
Wait, really? Retroactively?
Yeah, they circulate in the bloodstream and kill any microfilaria, which is the larval stage of the heartworm, that your dog was exposed to over the previous 30 days. So it's essentially a monthly system wipe of whatever they picked up.
Exactly. It's a retroactive purge. If you wait 45 or 50 days to give the pull, those larvae have time to molt into a later developmental stage.
Uh-oh.
And once they reach that advanced stage, the monthly preventative can no longer kill them. They will continue to mature, they'll migrate to the dog's heart and pulmonary arteries, and grow into foot-long adult worms.
That is a staggering biological detail. It completely changes the risk calculation. You aren't just stretching a timeline. You are missing a critical developmental window of a parasite.
And the consequences of missing that window are devastating. The treatment for an established heartworm infection involves deep intramuscular injections of an arsenical compound to kill the adult worms.
That sounds awful.
It is incredibly painful for the dog. It requires months of strict crate rest so the dying worms don't cause fatal blockages in the lungs. And frankly, it is a massive financial burden.
And with fleas and ticks.
It's a similar equation. Depending on your geography, ticks transmit diseases like Lyme or ehrlichiosis, which can cause lifelong joint or immune issues.
So you are effectively treating the minor inconvenience of setting a calendar alert for a massive physical and financial catastrophe.
Pretty much.
Because you cannot anchor a monthly pill to a daily habit, you have to anchor it to the calendar. You pick a highly memorable date, like the first of the month, or your dog's birthday. And the critical step is that you must physically log at the moment it touches the dog's tongue.
Yes, write it down immediately.
A note in your phone saying, Peanut, heartworm, June 1st. Because I promise you, by June 21st, your brain will have no idea if that memory is from this month or last month.
So true. So we have these robust systems in place. We have our fridge trackers, our daily anchors, our calendar alerts. But all systems are susceptible to environmental shocks. What happens when the routine is blown up entirely?
Travel. Travel is the ultimate stress test. I actually tested this myself recently. Yeah, I had my fridge notes perfectly dialed in, feeling incredibly organized. And then I took my dog on a road trip. The absolute moment we left the kitchen, my entire system collapsed because the fridge, my primary visual cue, was hundreds of miles away.
That is exactly why travel requires a dedicated secondary protocol. The materials outline a very specific approach for this. First, you pack the dog's medical supplies in a dedicated bag before you pack a single pair of socks for yourself.
Prioritize the dog.
Always. Second, you pack surplus doses. Flights get grounded, cars break down, weather delays happen. You never want to be rationing a critical medication in a hotel room.
Absolutely not.
But the third step is the most vital. The medical passport.
Right. The idea that you must carry a written physical note detailing the exact medication name, the milligram dosage, and the administration schedule right on your person.
This raises an important question, though. Why physical? Because if you face a medical emergency on the road, you are not walking into your primary clinic. You are walking into an unfamiliar veterinary hospital at like 2:00 a.m., and that new veterinarian is effectively flying blind.
Right. If my dog is in distress in a strange city, I definitely don't want the vet guessing their baseline.
Exactly. If you can hand them a physical document detailing exactly what is in the dog's system, you fundamentally alter their diagnostic capability. They immediately know which emergency drugs they can safely administer without triggering a lethal drug interaction. You provide the exact data they need to save your dog's life.
And what about the lapses that happen when we aren't traveling? Let's say we just flat out mess up. We miss a dose of a daily medication. We realize it 14 hours later and total panic sets in. What is the golden rule?
The absolute golden rule is never double up based on your own judgment. Never. As we discussed with the NSAIDs versus antihistamines, the pharmacokinetic profile of every drug is wildly different. For some medications, giving 2 pills close together to catch up is completely harmless. For others, it pushes the concentration in the blood straight into toxic territory.
So what do we do?
When you realize you've missed a dose, you hold the medication, you call the clinic, and you ask for specific instructions based on that specific drug.
So what does this all mean when we put the pieces together? Notice the pattern here. Call the clinic. The veterinarian is our partner in this entire logistical dance.
Yeah.
Which brings us to a fascinating insight regarding the reality of the veterinary exam room. All of this tracking, the sticky notes, the digital logs, it ultimately serves one critical purpose: empowering the vet.
We really have to recognize the immense constraints veterinarians operate under. A standard appointment is 20 to 30 minutes. In that tiny window, they're trying to solve a very complex biological puzzle.
And the patient can't talk.
Right. They cannot ask their patient where it hurts or how long they felt dizzy. They are relying entirely on a physical exam and the history you provide.
And this is where the human element, specifically like our ego and our guilt, can severely derail the science. I know pet owners who have missed 3 months of heartworm preventatives. They go in for an annual exam. The vet asks, have we been consistent with the preventives? And the owner panics.
Oh, I've seen it happen.
They say, yep, every single month on the 1st. Because they are absolutely terrified of looking like an irresponsible pet parent.
It is a deeply human reaction. No one wants to feel judged by a medical professional, but that lie directly sabotages the diagnostic tree.
How so?
Well, if a dog comes in presenting with a subtle cough and lethargy, and the owner insists the heartworm prevention has been flawless, the veterinarian will cross heartworm right off the list. They will start running tests for kennel cough or allergic bronchitis, or they'll do echocardiograms looking for a heartwormer. They are burning time and your money chasing ghosts.
Because you fed them bad data.
Precisely.
Yeah.
And by the time they realize the data was flawed and test for heartworm, the disease has progressed significantly. Veterinarians are not there to judge your sticky note failures or scold you for missing a month.
Right.
They are scientists who desperately need accurate data variables to solve the equation and help your dog. Brutal honesty is the greatest diagnostic tool you can provide.
To help organize that data, the materials do mention digital systems, like the VitalPet app. These tools are fantastic for aggregating logs, setting reminders, and keeping that medical history in one place right on your phone.
They're very helpful.
But there is a crucial distinction made. An app is purely a support tool. It is an organized filing cabinet. It works alongside professional veterinary care. It does not replace the expertise of a doctor evaluating your pet in real time.
Exactly. An app cannot listen to a heart murmur or palpate an abdomen. Its sole function is to make you a highly efficient historian for your pet.
All right, let's pull the threads of this deep dive together. The ultimate toolkit we've extracted today to bypass our flawed human memory is this. First, recognize the biology of antibiotics. Finish every single dose to prevent resistance, no matter how happy your dog looks.
Super important.
Second, manage chronic daily meds by anchoring them to an unbreakable routine like feeding time. Third, neutralize the multi-human problem by designating one point person and using a highly visible physical tracker.
The fridge sticky note.
Yes, the sticky note. Fourth, respect the biological window of parasites by rigidly logging your monthly preventives on a calendar. Fifth, protect your pet during travel with a written medical passport. Sixth, never double up on a missed dose without a vet's explicit instruction. And finally, be brutally, unconditionally honest in the exam room.
It is a comprehensive framework, and the overarching philosophy here is not about striving for some impossible standard of perfection. We are all going to drop the ball occasionally.
Absolute.
This is about building resilient systems that catch the ball for us. It's about removing the daily anxiety, ditching the cognitive load of constantly trying to remember, and ensuring our pets receive optimal care even when life becomes totally chaotic.
You don't have to carry the mental weight of the pharmacy anymore. Let the system do the heavy lifting. Now, I want to leave you with a final thought to mull over, something that really struck me as we mapped out these intricate protocols. We are willing to go to extraordinary lengths to build these fail-proof, multi-layered systems for our dogs. Right? We study the biological windows, we create physical fridge trackers, we coordinate with our partners, we pack medical passports.
We essentially engineer a protective bubble around their health routines.
We do. We treat their health with the utmost operational rigor. But what does it say about us that we almost never apply that same operational rigor to ourselves?
Oh, that's a good point.
We manage our own human health habits in total unmitigated chaos. We forget our own vitamins, we skip our annual checkups, and we definitely stop taking our own antibiotics the second our sinuses clear up.
Guilty as charged.
So the provocative question I want to leave you with is this. What would happen if we applied the exact same canine standard of care to the humans in our households? Could you use these identical anchoring systems and fridge sticky notes to ensure that you're actually taking care of yourself with the same fierce dedication you show your dog?
It's an incredible insight because if the biological principles and behavioral systems are robust enough to keep Scout and Peanut thriving for years, they're absolutely robust enough to work for David too.
Exactly. So the next time you are standing in your kitchen, totally paralyzed, staring at a pill in your hand and wondering, wait, did I do this already? Take a deep breath. Put down the pill, call your vet, and then go find a pen and a sticky note and build a system that won't let you or your dog down tomorrow. Thanks for joining us on this deep dive.